If you're suffering from hip pain, you may be wondering if it's the result of arthritis. But what is arthritis exactly, and how do you know if you have it? In this video, I'll explain what symptoms to look for to possibly determine whether or not your pain could be caused by hip arthritis. I'll also explain what can be done to treat the condition and help relieve your pain. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. The hip joint's a complicated structure. It's made up of the femur, which is the thigh bone, the acetabulum or the socket, and other bones in the pubic area and pelvis. The joint itself has a number of different ligaments that help stabilize the hip joint. There are also muscles that surround and support the joint as well. When all of those are working properly together, they allow you to move with a wide range of motion without pain or without discomfort. But when one or more of the parts of the hip joint, especially the cartilage and bone, get damaged or worn out over time, they can cause symptoms like groin pain, difficulty bending down and squatting, limping on one leg, and many more. Now, hip joint injuries usually cause groin or upper thigh pain. Again, the hip's a ball and socket joint that connects basically the ball to the socket, connects the thigh bone to the pelvis. And that socket is deepened with cartilage, and that cartilage cushions the impact of walking and running and other weight-bearing activities. So the pain with hip arthritis is often felt in the groin or upper thigh as opposed to the buttock or to the outside of your hip. You might notice pain when you sit for long periods of time or when you get up after sitting for a while, like when you're sitting on an airplane for a little bit or in a car and then you get up. You might also notice limping or favoring your arthritic hip. Limping is very often a sign of pain. If you limp, it means your hip is not working the way it should. Yes, this could be a sign of arthritis, but it could be a sign of other problems in your hip joint. Pain with hip motion. The symptoms of a worn out hip joint or hip arthritis include pain with walking, running, squatting, and climbing stairs. You also may experience pain when you try to walk on uneven ground or stairs that have even a slight bend in them. If you've been experiencing this kind of discomfort, it's possible that the cartilage and bone inside that hip joint are wearing out. You could have decreased range of motion in your hip. If you experience that, maybe you can't squat down to tie your shoes or can't cross your legs the way you normally do. You can try to test for this yourself. Lie on the floor, raise one leg as high as possible. See if you get to where it is basically the limits of pain or discomfort. Do that with the other leg and compare the heights of the hips. You can also twist the hips internally and externally on the painful hip compared to the opposite hip and see if there's a difference. And then if you suspect you have hip arthritis based on any of these symptoms, it's important to see a doctor to see if arthritis is the cause of your pain and other symptoms, as well as learn steps and learn treatments that you can do to decrease your pain and get you back to what you love to do. I'd love to hear your experience with your hip pain or hip injury. Leave those in the comments below. Just realize I can't offer you medical advice online, but I'll try to answer your question in a future video. Also, make sure to subscribe to my channel to be notified when I release a new video or when I start a new live stream like my Ask Dr. Geier live shows. Just click the bell to be notified. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.